Welcome to the fourth annual Brooklyn Stroke Symposium. I'm Dr. Tony Wang, Director of Jeffrey Comprehensive Stroke Center at Maimonides Medical Center, and Vice Chair of Neurology for SUNY Downstate Department of Neurology. We're very delighted for you to join us for this event. We have Dr. Daniel Rosenbaum, who's our Regional Chair of Neurology at both Maimonides Medical Center and SUNY Downstate Department of Neurology, and a Distinguished Service Professor of Neurology at SUNY Downstate, to give us the welcome remark. Go ahead, Danny.
Okay, can you hear me clearly? Tony?
Yes, we can hear you.
Okay, great. Well, I just want to echo, Tony's welcome. This is the fourth annual Brooklyn Stroke Symposium, and actually we have a record number of registrants this year. The number is 677, and the numbers just keep going up year by year, which I think speaks to the success of this symposium. I would like to thank all the speakers, both within the SUNY Maimonides Center, as well as those speakers who's come from outside New York, including as far as Europe. And in particular, I want to give a thank you to Tony, who's done a phenomenal job with this, and Belly Brahma, who is our stroke coordinator. It's really a Herculean task to put this symposium together. I just want to give a very brief perspective, neurology in general and stroke. When I was a resident in neurology, the saying was diagnose and adios. There was very little we had to offer in terms of therapeutics. Over the past several decades, there have been dramatic advances not only in the diagnosis, but treatment and systems of care. When I first started off as a stroke fellow, the International Stroke Conference lasted a day and a half. There were about 500 participants, and there was only one session going on at a time. Now there are over 5,000 participants over 3 days with multiple concurrent sessions, which I think speaks to how the area of stroke has just blossomed and expanded dramatically over the past several decades. So without any further ado, I would like to bring Tony back and have him, introduce and give welcoming remarks for this session, which I think will be a wonderful opportunity for all those who are participating. Thank you.
Thank you, Danny. Again, welcome to our fourth annual Brooklyn Stroke Symposium, jointly sponsored by the Jeffrey Comprehensive Stroke Center at Maimonides and Department of Neurology at SUNY Downstate Health Science University. Every May, we unite here during the National Stroke Awareness Month to celebrate and share groundbreaking research and advancement in stroke management. Our symposium features an array of esteemed speakers, providing insights into clinical perspectives, practices, and also cutting-edge research. I hope you'll find the presentations and discussions both inspiring and informative. This year's theme is twofold. It emphasizes a multidisciplinary collaborative approach towards the clinical management of stroke and the importance of clinical system integration for optimal care delivery. Also, along with our institution's latest advancement in stroke research, we'll highlight recent breakthroughs in individualized and evidence-based clinical care in stroke patients. The Jeffrey Comprehensive Stroke Center at Maimonides, located at the heart of the Brooklyn, is nationally recognized by the Joint Commission and the New York State Department of Health as a certified comprehensive stroke center. Our center is proud to advance the field through innovative clinical care, cutting-edge research, technology, and also training of the next generation of experts. For the last 15 years in a row, we have earned the top honors in the American Heart Association Get With The Guidelines Awards and being recognized with the Gold Plus Quality Award for our consistent compliance with quality measures. In addition, our center is recognized with the Target Stroke Honor Roll Elite Plus designation with practice experiencing door-to-needle time less than 6 minutes. Under the leadership of Dr. Daniel Rosenbaum, who just gave you the welcome remark, in collaboration of our talented faculty and staff, we continue to transform clinical practices and improve clinical outcomes with multidisciplinary collaboration. and new treatment paradigms and technologies. We're excited to have you join us today for the discussion and presentation. Please also welcome our esteemed distinguished faculty and guest speakers. Thank you for being part of this important annual event that really highlights the advancement not only in stroke care locally, but also nationally for what we can do to our patients. And we truly wanted to appreciate our dedicated staff and faculty, and also honoring those patients and their family for placing their trust in us, taking care of them at their most vulnerable moments. Thank you so much.